Hi guys, this is Dr. Bhupesh from Dr. BKM OET Institutes. The best of all, it doesn't look nice to say that way, but yeah, truly the best of all. And you may subscribe our channel. And if you don't know we are the best, this video will let you know. So yeah, talking about small things, sometimes when people write, see, when we write the discharge letter or visit letters, please understand what we are trying and do. The most important thing is to whom you are writing the letter. That is the main thing. Always consider. Again, the same thing if you're writing to psychiatrist, you will include the mental status first. But if there is anything like if you're writing to orthopedician and the data is given that the patient has two brothers, the patient has a sister, then why would you write these things to orthopedician? Orthopedician is just to fix the bones, so what he will do with the social history of the patient. But if the medical history consists of osteoporosis, you talk about it. When the medical history consists of diabetes, you talk about it. When the medical history consists of hypertension, you let the patient know, because you let the orthopedician know, because he has to perform the surgery. But diabetes is not related with the psychiatrist. But if the patient has diabetes and diabetes is causing complications like retinopathy, and the patient is unable to see, that is why he is anxious, then this becomes important. So please behave like a nurse and a doctor to understand what OET is all about. If the patient is having diabetes, then if then it is not related to psychiatrist or psychologist. But if patient needs the counseling for diabetes, then psychologist is required. If the patient is having mental stress and diabetes is leading to various kind of ailments and causing him anxious, and stress is leading to other kinds of mental diseases like whatever you can say, acute maniac episode or some acute maniac is not right, means leading to depression, then you will write to a psychiatrist. So whole of the data selection depends upon to whom you are writing the letter. That is the main thing. In the visit letter, last visit is the most important thing. The grammar that is used in the visit letter, first and last paragraph, both. First and last paragraph, the main grammar is has been plus third form. Why do we write so? Why do we write so? Please understand, because you are talking, has means present. Been plus third form means passive voice. How do we write it? So today, the patient has visited. Now you will say, sir, you are just talking about has been. Now you are not writing been, because this is active voice. Patient has come by himself. Patient has presented by himself. Been plus third form is a passive voice. So patient has presented with whatever the problem on examination. Now examination is done by us. So on examination, he has been found with. That is your passive voice. He has been found with this thing. Therefore, he has been suspected with this thing. Therefore means that these are the symptoms, these are the signs. Therefore, he has been suspected with this thing, for which your expertise is highly required. So that is simple grammar, yeah. That is simple grammar. That is for the visit letter, first and the last paragraph, right? But when it comes to discharge back letter, people have so many problems, or discharge letter. People have so many problems in the last paragraph of this. Please understand a discharge letter. What is a discharge letter? Patient has come to your hospital, you are a nurse or you are a doctor. You are discharging the patient. You are When you are discharging the patient and you belong to a hospital, that means hospital means you have treated a big thing and now the patient is better. Most of the time when patient will be discharged from the hospital, he will need follow-up care, because hospital would have treated the patient. Now the patient needs only follow-up care. So the last paragraph, what you are doing, suppose if you are writing to a community nurse, district nurse, social worker, community support worker, or to the family GP even, then it is a referred back letter if you are writing to family GP, but discharge would be there. Discharge would be there. So how would you write the last paragraph? So now please understand, how would I write? I am a nurse or I am a doctor at big hospital. Patient is being discharged. So how would I write it? Please understand, and please understand. I will say it would be greatly appreciated if you could. So I will tell the nurse or to the family doctor or to the community support worker that, see, buddy, it would be greatly appreciated if you could. After could, always first form. Can, could, may, might, any modal. After that, there is always a first form. It would be greatly appreciated if you could arrange, educate, whatever is given. Educate, first form. Encourage, whatever the thing is. Again, you can write simple. So if you could appreciate, if it would be greatly appreciated, sorry. It would be greatly appreciated if you could arrange, educate, encourage, assist, help, means whatever is given. The patient, if you could arrange this or help the patient in this and this thing. Suppose if the patient was of diabetic complication, after diabetic complication, he became better. Or maybe if the patient came to you because of the fracture, you have applied the plaster cast. So you will say, if you could assist the patient in walking, in ambulation. Suppose that is the best point, first point. So I have used the first form. If you could assist the patient in ambulation as he needs support to walk at the moment. So I tell the reason that at the moment that patient is unable to walk. So the first point, I say this. Second point. Now suppose second point is given, liaison with a GP uh, who can educate the patient about how to deal with after effects of the fracture. Or suppose there is a complicated point. So always try to make that point simple, that kindly help the patient or kindly arrange a meeting. Means try to try to find the most complicated point and write it in the most simple way. Kindly arrange a meeting with GP to educate the patient regarding management of after effects of fracture. Means whatever was the most complicated point, I wrote it in the simple way. And always remember, kindly is an imperative sentence. Imperative sentence means after kindly, there is always a first form. Kindly sit down, kindly stand up, kindly go there, kindly come here, kindly do this thing, always first form. And in the kindly sentence, there can never be should be plus third form. It cannot be a passive voice. So kindly word will come with first form and there will never be a passive voice with it. So please don't combine or mix sentences because of your less knowledge. Please understand this is a complete sentence. It would be greatly appreciated if you could do this thing. Even if I change this sentence and write kindly, even then this sentence is fine. Kindly assist the patient in ambulation as he needs supports to walk. Then if I copy paste this thing over here, it would be greatly appreciated if you could arrange a meeting. There is no difference. Both are active sentences. So if I have to make this sentence first, I will simply cut and put it in front. Please understand this thing. Give yourself time. Listen to this recording again. That this is just way of writing. If you could, even if I replace it again and put it in place of kindly, sentence will not get changed. And kindly I will put it. It's just the words. It's just two different ways of saying same thing. And why do you want two different ways? Because if you will say kindly do this thing, kindly, how would examiner know that you have grammar, you have knowledge of grammar? That is why you change these words. So always the first line you start with, it would be greatly appreciated. So again, I will put this line first. It looks nice. And then you make the second sentence, which is imperative, kindly arrange. Or even if I have to change kindly educate the patient, I just have to use the first form, kindly educate the patient. Even if I again change this thing, it would be greatly appreciated if you could educate the patient. Even then this line will go fine. and kindly assist the patient in ambulation, still will go fine. No problem at all. Now, what is passive voice? Suppose kindly assist the patient in ambulation. I have to make the same line. This is the third way of writing. You are writing third way of writing to tell the examiner that you know active voices, you know passive voices. That is why you are writing. So the patient should be assisted. Simple. The patient should be assisted in ambulation. This is the third way of writing. Same sentence in ambulation or in mobility, in improving his mobility. You can shuffle the words. The main thing that you need to learn is grammar. The patient should be assisted. Now this is a passive voice. Be plus third form. And if you have to, then if you have to write the next sentence, and he also needs to be educated. Needs में S is very important. Why? Because he needs. He, first form, he needs to be encouraged to go for walk every day. Means this is just the way of writing. These are the four major sentences of grammar that you should know. It would be greatly appreciated if you could kindly do this thing. The patient should be assisted in this thing. And also he needs to be encouraged. Always be plus third form. Sorry. I will make it more clear. Now, if you want to shuffle the word, the patient needs to be, okay, there you go. Patient needs to be assisted and he also should be encouraged. Not a problem. No problem. You're just showing your grammar. Okay, to walk, to go for walk, sorry. All after to, always first form. If to be, that means it's a passive voice, then third form. He needs to be encouraged, he should be encouraged. So these are separate sentences. Kindly wala sentence will never go with the passive voice. Never ever. If you want to mix these two sentences, you have to use a connector. And he needs to be educated. Then you can do that when you are making two separate lines and you are using a connector. Otherwise, kindly wala line will never be mixed up with passive voices. Kindly means imperative sentence. So he also should be encouraged to work for this thing. Further, last line. Further, you want to make it nice. Further, it is important to be noted that he needs to, or like today, physiotherapist, it is important to be noted that physiotherapist, or simple that there is a meeting with physiotherapist, or there is an appointment, that there is an appointment with physiotherapist at 2 p.m. at on 26th, 28th of November 2016. That's how you write. And if you realize the same thing, that is what I actually did in today's letter when it was of Goldstein and Eventide Residential Aged Care. It would be greatly appreciated if you could provide a follow-up care, because this letter did not have too many points. So I wanted to tell examiner that I know passive voices. That is why I did not make kindly wala sentence. I just made better sentences. She needs to be monitored for this and this thing. Further, please note she has an appointment with physiotherapist at two things. So I made this sentence simple. Medication chart is also being enclosed. That's a passive voice. That is being enclosed means present continuous. The same way this letter is being written, that's a passive voice. Written by me in the present continuous tense. That means I am writing the letter right now. In the same way, medication chart is being enclosed. That means I am enclosing the chart now in the letter. So it's present continuous. So is being third form, again a passive voice. That is what you want to tell the examiner, that how good your grammar is. So it's not about, it is again, you can shuffle any line. I'm not saying this line cannot be, you can also say kindly note. So you can make this line simple, kindly note. What's the big deal? then I made it better. It is important to be noted. So even in this thing, if I say, please note, I can make it better. Further, it is important to be noted that she has an appointment. So you make it better. First, you control, first try to learn simple grammar, understand grammar, then make changes to it. Don't complicate yourself. You have to learn writing easily, then we will modify a couple of sentences like this. So don't rush in, don't jump in, take it easy. One writing, if you will do without mistake, and once you learn grammar, nobody will be able to fail you in writing. Nobody can, because if you know grammar, then you will pass. Why? Because then in exam, you would be able to focus on data. If you are not a master of grammar, then you will be like, oh my god, I have to make grammar. I have to, oh, sorry, I'm confused between data. Then you think about grammar, then you think about data. So master your grammar first. By this video will definitely make you a master of grammar, and then you would be able to focus on the data in the exam, and you will not have a confused state, and things would be very simple. Again, this is Dr. Bhupesh from Dr. BKM Institute. Uh, 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 subscribe this channel if you have not. Our number is 76967342256 for the best OET coaching. And like this, fumbling can happen in OET speaking. They will not fail you for one fumble. We all are humans. Just try and do better. Means in a way, if you by chance have a fumble, but you are speaking like this, they won't fail you. Fumbling is okay, but obviously we should avoid it. I'm not saying you to fumble, but if I'm speaking such good English and by chance I fumble, he won't fail me just for one fumble. If you will keep on speaking good English, he will pass you. He has to pass you. Thank you very much for your patient hearing. Thank you.